If you're a pet owner, you most likely have questions about your pet. Sometimes they seem like minor things, but they could actually signal the beginning of a larger problem. In today's Ask Dr. Mike segment, we're talking about the usual suspects. These are common problems veterinarians see where early detection and treatment could save you money and give your pets longer and healthier lives. Dr. Mike Hutchinson of Animal General in Cranberry and regular PTL contributor. Good morning.
Good morning. Good to see you.
Good to see you too. And this could be something that you might think is just minor.
Yeah, well, we start with the pudgy pets, and everybody thinks it's not a big deal, especially when they're young. Oh, my cat's just a little, or my dog. And people, when they come into us in the exam room, they're surprised sometimes. I just had one in the other day, for example. The dog was 30% overweight, what we would consider an ideal weight, and the owner thought the dog was perfect. So it's really something you should get advice on. We usually do think our pets are thinner than they really are, and we can give really good advice how to get that weight off. It's not hard.
I love, first of all, if you're not looking at the TV screen right now, we have these wonderful graphics. Wanted, pudgy pet, known as couch potato. Weight too much.
Yeah, this is what happens. 65% of the pets come into the vets here in America now are overweight. Wow. So we really want to get them down because it's not just for end of life where it makes it easier for them, it's their whole if we can get that weight down. And we control that 100% by what we feed them. So I get pretty strict about that, but it's not hard. Even in cats, it's not hard. We can give some really good tips as long as the family follows those tips.
Can I ask you about this? Because we just recently brought a new puppy into our home, and I've seen this trend with grain-free dog food. Is that the way to go?
No, that's just kind of a marketing tool.
Oh,
so when you talk about what pets are mostly allergic to, it's larger molecules like proteins.
Okay.
So the top four are meats, not the grains. Corn is number 8. So the grain-free is kind of a marketing tool that's not necessary. There might be individuals that will benefit from that, but most of them, that's just a marketing tool.
I was going to ask because the grain-free, like if we go on a carb-free diet, we tend to shed some pounds, so I wasn't sure if that could help.
Well, grain-free isn't carb-free, so it is a bit of a different diet. So, but I would say no, speak to your veterinarian, and 98% of us feed commercial food, and that commercial food is formulated for that pet's lifestyle or age or breed sometimes, and we can really find a good food for those pets. And if we do feel that they have allergies, we can give recommendations for that too. Okay,
so we're talking about stinky breath in our dogs.
Halitosis. So that's the word for bad breath, halitosis. But yes, that is something that usually is related to gum disease, gingivitis, and plaque and tartar. And our pets get it too. And if we can brush their teeth, that would be the easy solution. We have dog and cat toothpaste that actually taste good and they can swallow them. They don't have fluoride in them, so they're not going to get poisoned by them, and we can help them that way. If we can't brush their teeth, sometimes we can put additives in their water to help them, and other times we can give them things to chew on that will help them. And there's some products that are recommended by the Veterinary Dental Society, like the greenies and some other treats that we can give to pets that have some calories in them, so we have to be careful, but they also help break up tartar and plaque, which is big help. And that's what causes gingivitis, which is inflammation of the gums, and that can cause bad breath.
Well, and our smaller, older dog has this. She needs to get 3 teeth extracted because of it. So it can be a problem.
If it gets up under the gum line, gingivitis can cause what we call periodontal disease, which is disease of the roots of the teeth and things like that, and then we'll sometimes have to remove those teeth. So.
Okay. All right, lumpy dog.
Yeah, lumpy dog. So every lump doesn't have to come off a dog, and I'm not trying to say that, but every lump should be seen by your veterinarian just to make sure. Sometimes we do what we call a fine needle aspirate. We just identify the cell types that are in there to see if it's trouble or not. And if you find cancer early, some of those lumps are cancerous. If you find cancer early, the outcomes are much better. So we like early detection, so we like to look at lumps if we see them. Sometimes it's a bug bite, and you just have to give it time, but other times it's serious.
Well, what about in older dogs too? Because that tends to happen, right? They get the little warts and bumps on them.
I had a 16-and-a-half-year-old Labrador that had 11 fatty tumors on him when he died, lipomas. That means that I didn't take them off. They didn't need to be operated on because they weren't in bad locations, they weren't real big, and they weren't bothering him at all. It's just a fatty tumor. It's a benign tumor. But there are other tumors that could look like a lipoma that could end up being very aggressive, like a mast cell tumor or something of that nature.
So when is the appropriate age that they would start to develop them in dogs? Like if it's a puppy, obviously, and you find one, that could be more serious.
Yeah, right. You'd want to get that looked at right away. It may not be serious, but you want to get it looked at and find out. They can develop growths and tumors and bumps, lumpy, bumpy problems at any age.
Okay.
But mostly we start seeing them when they start to become senior dogs, mostly. I mean, lipomas, fatty tumors, we start to see usually around the age of 6 or 7 on large breed dogs. But that's not nobody reads the book. So sometimes you see them at 6 months, and so we have to get them checked if we see them.
I was amazed just how much cancer treatments cause in your pets.
Yeah, it's
cost.
So well, we can do cancer treatments. I actually tell people that get puppies now to consider getting pet insurance because it's gotten a lot better, and it really does cover lifelong treatments like cancer treatments. It even covers stem cell treatments, which I do a lot
of.
And
really nice. Let's talk about the sniffles in your cat.
Yeah, so sniffles in cats, upper respiratory infection can be something really easy, but people don't realize when we vaccinate a cat, we're vaccinating for these upper respiratory diseases. We call it distemper, but it's a whole complex of viruses that cause sniffles. And so if we don't treat those easily and try to support the cat's immune system or get rid of the secondary bacteria that might be causing an issue, they can end up with chronic infections where they're sniffling their whole life, and that can be a problem. So I always tell people if you have a sniffling cat, don't watch it for too long, maybe a day or two, and then you should call your vet and see if it should be seen.
So will they actually, I've never had cats, so will they actually sniffle?
Oh yeah, they'll sniffle, they'll get runny eyes, or just like us, when we get a head cold, they'll start sneezing all of the time, and that's and if you see them sneezing a lot, you should call your veterinarian. And you start to see discharge too. Now the clear discharges aren't as serious as the unclear discharges, like the green or yellow discharges, but still I would recommend calling your vet because we might even provide a supplement like something like lysine, which is an amino acid food supplement that can help prevent replication of viruses in that animal's body.
How do they get that?
Well, just in the environment. So if we were to go outside, or these cats, most of them come from the outdoors, their mother gets exposed, so it's just everywhere. We call it ubiquitous. Distemper and all of these diseases have been around for a long, long time. That's why we try to vaccinate to protect against them, because we can't cure them yet. But we can treat them, we can support them, and we can hopefully prevent them, and that's what the vaccines are for. So
I'm sure you are just constantly overwhelmed by questions because, I mean, really, we see these little things in our pets, and sometimes you just pass it off like, oh, they'll be fine. Well, they can be much bigger issues.
The exam room is the love of my life. I call it my therapy, so I love answering these questions and trying to help, especially if we can prevent things.
Well, and I loved the little graphics we had today. It really,
me too. Thanks.
A little lighter side of more serious issues.
The American Veterinary Medical Association provided those graphics, and I thought they were just right on.
They're perfect.
So, yeah.
Well, thank you, Dr. Mike, for joining us today. We always appreciate your advice. And of course, Dr. Mike Hutchinson is of Animal General in Cranberry. He's a regular contributor on the Ask Dr. Mike segment here on PTL. You can listen to his podcast and find him on KDKA Radio as well.